This is probably the most uncertain future that I've seen since I've been in healthcare. We really can't right-size the American economy without right-sizing American healthcare.
It is strategy, it is finance, it is information technology. How are we going to use them in the 21st century?
I'm the president and CEO of Salem Health here in Salem, Oregon. We're a community health system with 2 hospitals, and I've been here about 10 years. We really had no roadmap, we had no strategic plan when I got here, and it was really obvious the organization really didn't have a sense of where it was going. I said, and I can't do this by myself. I've been working with Kurt Salmon probably the bulk of my career. Started in the 70s. It's a relationship that I cherish because I think they really bring value to the table. Within the first 6 months I was here, we brought in Kurt Salmon, really kind of took an inventory of where we are and laid out what was actually a fairly pragmatic, probably 3 or 4 year plan. One of the values in working with Kurt Salmon originally on the strategic plan was saying, what are the areas, for example, clinically, just to pick on an area, that we want to focus on. We had no what are called service lines at that time, things like cardiology, oncology. As we fast forward 10 years, we were ranked the highest cardiology program in the state of Oregon a couple of years ago, and we've made some real strides around joints. One specific area that I think is worth mentioning in terms of our use of Kurt Salmon is around information technology. IT's gotten so complicated in healthcare, very difficult, if not impossible to do.
One Saturday morning, my cell phone rang, and it was Mr. Gruber wanting to talk about a pressing issue that he had been thinking about at his organization, particularly with information technology.
We had put in a very sophisticated, very expensive system that was really not working well. A lot of dissension amongst the troops, if you will. We had sleepless nights over this.
Monday morning, we had 2 of our information technology partners on the phone with Mr. Gruber discussing what the issue was and what we thought needed to occur. And he said, when can you be here?
Out of that really came a short and medium and long range plan that has led us today to an IT system that I would hold up against any health system in the country. We've used Kurt Salmon in a variety of ways. We've developed a $220 million building project. It really proved to be valuable in terms of on schedule, on budget.
Today, Salem Health is one of less than 60 hospitals in the country of this size and capability that are delivering the sustainability, the quality that they do today. And we believe that Kurt Salmon's healthcare group has had some small part of help advising them on their way to that success.
What I have found that Kurt Salmon brings to the table is what I would call value. And value from the standpoint of really providing something to you that you couldn't do yourself. They don't tell you what you want to hear. They tell you what they believe is the right thing to do. That's what you're looking for in a consultant, not someone who is just going to reiterate what you already know.